Full inflammation up through this area here. So it's probably been overworking for quite a bit, some time now, possibly. Do you have any SI joint pain inside the SI joints area?
Sorry,
I don't think so.
Okay, just straight, she just feels tension through here, okay? So we're just gonna go through and work the QL in the form that it's supposed to be. Let me see it, grab it. I wanna make sure I get the order right in this new book.
There we go.
Who has the picture and the order? Who would like to read the first one? And that's the way we'll do it. That way I'll keep it right. Michael will read, right?
Michael will. Michael loves to
He
read.
reads well.
Quadratus lumborum?
Yep, the first picture.
And same.
And I need some lotion, some nice lotion.
Yeah.
Put that four-letter word in
Okay. Cocoa Comfort. Is this lotion or oil? Oh, it's lotion. Fantastic. Okay, first step.
Quadratus lumborum. Lumbar plexus T12 through L4. Sacroiliac and lumbar.
T12 through L4. L5 is at the top of the sacrum. You come in, you find the top of the sacrum. The first nodule above that is L5. So L4 is here. Okay? So we got that.
Position.
L4, T12.
Step 1. Glides on quadratus lumborum belly.
Which way?
Glide and stripe superiorly from the iliac crest to the edge of the 12th rib until the entire muscle is covered.
Okay, so all we're doing is, you know it is inserting on the iliac crest. You're going to start lateral to the spine. You're going to do superior glides. So you can do an anchored glide and one thumb, or you can do both. I like both. Superior glides. It's not going to let me glide real nice. So I'm just sinking into the tissue as it lets me slowly glide. It might let me in the next 2 or 3 times. Up to T12, where it tells you what's a rib, right? Yeah, the last 12th rib. So you come up to the 12th rib. Now, most people's ribs sit inside their hips. The normal distance between your bottom rib and your top hip is 3 fingers of your own. Sometimes 4, depends. Lately it's been
Mine are like right in there.
so when you have all this anterior stuff, the ribs sitting right in the hip, so when you're doing QL, your glides are going to be like this because the ribs are sinking so far down, and then you've got all this bunching of the QL in through here. So you have to palpate that rib. So you got to find that lower rib. Best way to do it is come around the side, then look for the little side floater, and look for the other one. Here's her ilium. And right in here, in this space, in the side of QL, her 12th rib is right about there. So I'm gonna come up just to that 12th rib there, and I'm just doing superior glides. Now I'm gonna move laterally. Superior glides, coming to the 12th rib, starting at the iliac crest, move up to the 12th rib, 2 to 3 times in the glide. And then again.
So the three fingers is supposed to be the space between the ribs and the...
Yeah, the last rib and the iliac crest.
Okay.
From the side. So 3 fingers, possibly 4. 4 is great. And you're looking at some real good space there. So I'm just reversing what I'm doing, and I'm coming back towards the midline as I do my glides.
So it's compressed lumbar spine?
Mm-hmm. Definitely.
Causing-
Yes, and bilateral contraction usually causes the hyperlordosis. So I'm just doing these from the iliac crest up to the 12th rib, and that's exactly where you're going to take it to. And it doesn't go any further out. The angle of QL is like this, where we're just doing straight strokes, and we're covering all of the angles this way. And then you just come up to the end, okay? So you do first superior glides. Okay, next step.
May repeat in same area with inferior glides
If needed. Okay, so we're going to come around. If you want to do inferior glides, you want to start again lateral to the spine, 12th rib. I'm going to anchor, and I'm going to go and do an inferior glide. And then I'm going to do an inferior glide. Then I'm going to take it to both hands, and then I'm going to do an inferior up to the iliac crest. 2 to 3 times, just covering the exact same thing we just did, like rhomboids. Remember, we reversed, came back up to the iliac crest. I'm going to stop at the iliac crest here. I'm pausing. Now I'm going to do a little friction here. I'm going to treat the attachment while I'm there. So then I can move over, come down, iliac crest, medial lateral friction. Come down, medial lateral friction. 2 or 3 times onto the iliac crest. Is it tender?
Not anymore.
It was at first.
Yeah.
Okay. I'm just keep repeating what I'm doing. I'm hitting the iliac crest here, and I'm doing medial lateral friction at the attachments.
So as was continued, set 3, friction attachments of QL.
Okay, there you go. So
A.
that's the inferior one. So where does A say?
A says with medial lateral friction treat the inferior border of the 12th rib.
So I didn't treat up here yet because I didn't want to confuse you. So go back up here, find the 12th rib. You can have your fingers like this. This is the only time that, this time, and there's a few other routines you can do. So you come to the 12th rib where it attaches. Fingers are touching, heads facing each other, straight down on the rib, and then friction medial lateral. This pushes, and then that pushes. Push, 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 push. Push one thumb into the other. It's not like this, it's not like this, it's just push the other thumb. So there's arm movement, not thumb movement. It's not this, it's arm movement, okay? Then you come to 12th rib again, medial lateral friction. Push, 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 push. Treating on there. So attachment, attachment, glides up, glides down. And next.
B. With medial lateral friction, treat the iliac crest from the transverse process of L5 to the lateral border of QL.
Okay. What are they talking about? Oh, from the transverse posture, though. Okay, to the lateral border. Okay, it's like, what are they talking about? So they're saying from about where the transverse process is at the iliac crest, all the way around to where the QL. How far around does the QL go? Does anybody know?
The middle of the...
It almost goes all the way to the ASIS, all the way around to the side. So you can actually treat all the way out to the iliac crest, all the way around, but I treat it in a different way. When I'm doing my glides, I hit the iliac crest, and then I treat it. Then I'm going to go back and then retreat the whole ilium from across the table, but I'll see if it says it. Go ahead.
Gently, with static pressure and craniocaudal friction, come under the lateral edges of the QL and treat the transverse processes of L1 through L5.
Okay, remember when we were learning erector spine A and we were looking for transverse processes and we came out and we went in like so? So you want to come outside QL, you want to hit a 45-degree angle, aiming for the transverse process. L4 is about where that finger, L3, L2, and L1. I'm going backwards. 4, 3, 2, and 1. So here you're coming in transverse process, cranial caudal at the transverse process. Sink in, transverse process, cranial caudal. And then come up a little bit more, slight angle up to L1 and here. So you're treating the transverse at a 45-degree angle, static pressure first. If it's too tender, don't do any friction, just hang out there. And then you can continue the move. You can even angle a little bit if you want, if you feel like you can't get to it. So 45-degree outside the erectors, through the thoracolumbar fascia and underneath. And transverse process. Now I think we're doing serratus.
Serratus, posterior, inferior.
Yay.
Serratus, anterior spinal nerves T9 through T12. Position prone. Step 1, treat the belly of the serratus posterior inferior. A. Glide on the belly of the serratus posterior inferior.